Hey,
All
good
right.
morning, everyone. Thanks for joining Brad and Jeff. Jeff is hidden. For some reason, I think he has like measles and he doesn't want to show his face. So no, he doesn't have measles, but there is that giggle that we all love. Anyway, thank you for joining us. Jeff, say hi.
Hi.
And cough. Okay,
I'm
good.
kind of
Uh,
blurred. So,
so anyway, we are thankful that you're all here, and we have Antidote, obviously, on the presentation today. This year, January 1st, was their first month, first year on exchange. Many of you, I'm seeing some of the names, have maybe been to some of our other trainings, and you are used to having seen or heard the name of Chris Jaquist. Chris Jaquist is taking on his original role to be plan president. So he's going to be working on network expansion, plans, all of that good stuff. But he found a great protege named Jason Madrak. And Jason, if I botched that, once you tell me, um, close enough. Okay. And so Jason is taken over as market president. Um, so he will be working with all of us in Ohio. So we've already had some discussions with Jason previously. So, be excited for Jason to introduce Jason. I don't know if your camera works or not, but that might be nice for just a minute. But if not, that's okay too. So, Jeff, next slide. Let me just go through a couple of things. As you all know, I'm seeing a lot of repeat offenders on the meeting. So, if you have questions, to put them in the question box. We'll get
and
them answered either in line or at the end. And then next slide, please.
I just want to jump in, guys. If
Oh,
you're having any issues like we did last week with the sound or any kind of glitchy things, and you see, you know, if you're having, I know it's difficult if you can't hear me, you don't know what we're saying, but if you're having any problems with the video or whatever, throw a comment in the question box, or better yet, if your things are working fine, tell me so in the question box that the sound is coming through properly. Okay, so throw a comment in the question box if things are working okay for you.
very good. All right. And if you haven't heard about this already this year, we are holding our Broker Expo once again this year. Jason will be there, which is really awesome. And for all of you that are not in the Northwest Ohio or Cleveland market, have no fear. We're probably going to be coming south in 2026. But if you haven't registered and you can make it to Bowling Green, State University. Why I still not say that? And in Cleveland Market, please register. I will put while Jason is speaking the link to register in the question in the chat box. So you just go to that and definitely register. Many of you will actually be receiving a postcard here in the next couple of days. We did it kind of backwards this year. So I want to pump up attendance because the really great thing is we have 19 vendors, which is three more than last year, carriers vendors from the individual market as a whole, ACA, under 65 short term, all of that, dental carriers, vision, all of that good stuff, indemnity. And then we have a couple other special guests as well. So please register. Next slide, Jeff.
And I appreciate you guys responding to me. It looks like everything's working great on the technical side.
Good.
And I'm going to toss things to Jason. And thank you, Brad.
Yeah, I'm going to go on
So
mute
All right,
and off.
perfect. Awesome. I feel like I'm on a morning talk show here, like Mike and Mad Dog. I feel like this is an ESPN show. This is awesome.
the two bald guys, that's what we are.
Yeah,
That's
two
what
ball
we,
guys.
it's really literally what we are.
I'm not quite bald, but I'm getting there real fast.
Uh-huh.
So yeah, and apologies, guys. I'm having some camera issues myself here. So maybe that's like a teaser. We will be at the Cornerstone event. So if you want to see what I look like in person, please come. I will be there. Look forward to meeting most of you. If you want an advanced copy, just go to my LinkedIn page and you can see a photo that's probably 20 years old.
Okay.
All right. So
So
I'm going to go ahead and share my screen over here so we can go ahead and get started. Bear with me 1 second.
good. Okay.
All right. Is everybody seeing that?
Yes.
All right. Perfect. Well, good morning, everybody. Thanks so much for carving a little bit of time out here for me and for Antidote. Look forward to chatting for the next 40, 50 minutes or so. I'm not sure how the Q&A works, whether people can just chime in, that's fine along the way. If not, you can certainly email me after, or will certainly leave some room at the very end to open it up if folks do have some questions. But here today, just to introduce Antidote to the group. Just personally, by way of background, I think I am Antidote's newest employee. I've been here for an entire month, so 4 weeks in. New to Antidote, but not new to the health insurance space at all. I've been doing this for way longer than I ever anticipated. I'm coming here from Molina, where I worked for about the past 5 years on the ACA side of the house. Also spent some time with other major carriers, Aetna, Anthem, some regional carriers such as Harvard Pilgrim up here in the Northeast, and have some experience with the ACA business firsthand after helping to launch the exchange here in Connecticut, where I'm based. Again, I've been doing this for a good long time. I'm really, really super excited to be here at Antidote as a new startup, doing things just a little bit differently. And we'll go through that today to give you a sense of what we're bringing to the market, why our approach is a little bit different, and why we think we bring a pretty good amount of value to members who you are going to be in contact with. So that just gets us into the agenda here. Introduction, I think we just covered that. We'll talk a little bit around Antidote's mission and background. We'll go into some detail around what makes this plan different. You're going to hear the word virtual care come up, and that's really sort of one of the centerpieces of why we are a little bit different. So we'll talk a good deal about that. We'll go over some things around our network, our footprint, which is really Ohio and Arizona. We do have some expansion plans, which I can kind of tease out a little bit, and then some of the plan review and member benefit details as well. This deck is a little long, and especially when it gets into some of the charts around the benefit designs. I will not sit here and read each line for you, but I will send this out afterwards so you guys have that, and you can see a very standard plan benefit grid, which will hopefully be helpful. But I won't go into a huge amount of detail on that. Once it's out, if there are questions, concerns, you can reach out to me at any point in time, and be happy to sit there and kind of dive deeper into each of those. So let's go ahead and just dive in. So Antidote, our origin, our background, who are we? So Antidote as a company has been around for a good while. Geez, almost I think 10 years at this point. So our co-founders are both from Israel. So we are an Israeli company, and they have a background in technology and medicine. So Avihai, our CEO, is the one with the technical background. His partner is a licensed physician with a medical background, and really came together to start a firm which was based in telehealth. So that would be your classic, teledoc. There's several competitors, but that's really where the company got its start, is trying to eke their way into that telehealth service provider. It took off very rapidly and did extremely well, up to the point where we were seeing about 50,000 patients over the course of a year. So widely adopted, really good uptick very quickly. But as we started to kind of go through that experience, it became very clear that there was more opportunity than just providing telehealth, that there was a real set of data which pointed to combining that telehealth experience with uh, an insurance side on the back end. So bringing together patients, providers, insurance, and really aligning all of those interests in a pretty unique way. And so that really is kind of where we're moving towards at this point, which is getting access to healthcare. It's a human right. It's a basic utility. It's like having water. It's like having a roof over your head. Everybody should have access to quality health insurance in order to make sure that we can all live our best life. And so there are two things again that I mentioned that are sitting underneath this as the foundation, which is that virtual care model, and then making sure that we're offering uh, a technology platform first and foremost that's going to be able to help us deliver that seamlessly and with great value for each of our members. So why are we different? So here's I like this slide. We could probably talk about this for the next 50 minutes, but we'll go over it pretty quickly. In terms of your typical health plan, limited geography, right? If you have to see somebody, it's always got to be in person. You're going to have to get in your car. You're going to have to drive. You're going to have to, find parking. You're going to have to go somewhere in order to see somebody to get the care you need. That's been the way it's been for a long time, and for most carriers, that's the same. That's been the same mantra. The virtual care equals one-time care. Uh, that's pretty much what telehealth has been historically, right? You got something wrong, you got a sore throat, you call telehealth, which has been promoted and took off pretty rapidly during the pandemic, but that's about it. You call somebody, they give you an antibiotic, and you kind of go on with your day. That's been how virtual care has been delivered or perceived. We're going to talk in much more detail about what we're doing, but that's been the typical experience. And then silos of health data. I don't think I have to tell any of you on the phone, but the information you have from one particular provider does not necessarily translate into going to someone else. There's a whole slew of information around your lab work, your blood work, if you had to have an MRI or an X-ray, and they all kind of just float around in these different silos, which is really difficult, especially if you have an ailment, for any one person to come in and be able to get a holistic view of what that looks like for you as a patient. So here's the sort of rub in terms of why we're looking to take that experience, which we just talked about, and really put a brand new sort of spin on it. So I'm going to go down this list, and again, we could we could take a lot of time to go over each of these, but I'm going to move at a pretty good clip here. So virtual care, it's always available. I know personally, I've had experience with being insured and scheduling an appointment virtually. It was burdensome. It was, you had to schedule it a day or two out. You couldn't do it at odd hours. It was nice to have it there, but it was not the epicenter and the focus of the coverage certainly that I had. So with Antidote, this is really the sort of core value proposition, if you will. It is always available. That is 24/7 at any point in time. You can log in through your app and immediately get connected with someone who can see you virtually, camera to camera, whether it's your laptop, whether it's on your phone. They can go ahead and they can see you. And in addition to that being convenient, each member gets assigned an Antidote virtual PCP. So you're not calling a complete different person every time that you dial in. Your doctor is there, and they will always be there, and you can contact them through the virtual network when you need to. Now, obviously, the the doctors are not awake 24/7, but once you get assigned that virtual PCP, you can contact them and set that appointment up from the comfort of your home anytime you want, which is a much better value prop than having, again, to go sit in the urgent care wing or sit in a doctor's office for an hour with other sick people you can actually just go schedule this call from the comfort of your home and talk to that virtual PCP whenever you want to go ahead and schedule that. Again, that PCP, they can be used for just primary care. It could be just a regular checkup, but they're also fully licensed, board certified, and ready to help you if you do have an urgent issue or chronic care. And we've seen a lot of excellent results of people who do have something like diabetes or maybe some sort of sustained cardiac issue use this virtual care model to be able to get excellent help, again, from the comfort of their house through the Antidote virtual PCP network. Again, talking about data, these PCPs, again, because it's a tech first and tech based organization, do have access to medical records. So they've got the same access that everybody else does through any kind of EMR system to be able to go ahead and monitor and talk freely about any sort of medical conditions you might have. And then lastly, you do have access as a member to go on to the Antidote app or a member portal, and you can see all of the same tools that our doctors have access to in order to be able to go ahead and manage your care or see how your care is being managed, which I think is a little bit more transparent than you might see from some other carriers.
Jason, just want to jump in here and try to answer one of these questions in real time. Question about specialists. I know you'll get to that, but
Mm-hmm.
curious about specialists.
Yeah, so I'll just keep it on this for the first time. So you're actually getting kind of to the crux of one of the major value props. So virtual care first, meaning you can always find a doctor going online or through your phone, having a virtual PCP, great. Our plan functions in sort of two primary ways. If you start with that virtual care first, meaning that's your point of entry into the health system for whatever reason, again, could be sore throat, could be diabetes, could be whatever. Um, if you start there, there are several benefits in terms of moving down if you do need a specialist or if you need actual physical care. If if there's something wrong and you need to go to a physical location, that's totally fine. So our plan functions in sort of two ways. The first is starting with virtual, but then it also operates exactly like a traditional HMO health plan. And so you can go ahead, see a specialist. You can go to an in-person physician at any point in time. The benefits to the member are if you start with the virtual model first, there's substantial cost savings, time savings, but you can completely get referred to a specialist. You can see a specialist. We have a very extensive network, which you will hear a little bit more about in the presentation. But both of those are on the table. It's starting with virtual care, but you have a full access to a rich, robust network that includes specialists and regular, in-person primary care doctors.
Thank you.
Jason, it's Brad. Let me just interject on this conversation because I've had it a ton of times um, uh, in the last 2 years. So, what is the typical, not just wait time, what's the process time for waiting and speaking with a virtual doctor? And I have a reason to ask this. So,
Yeah, so you can schedule an appointment virtually, just like you would with a regular in-person PCP. So you could say, I want to see somebody tomorrow at, noon because that fits my schedule. That's totally fine. You can log into the app at any point and say, I want to see somebody immediately. Our turnaround time or SLAs for that are typically it's under 20 minutes. And that would be for, again, an urgent, I need to talk to somebody right now. But if you want to speak to your prescribed PCP virtually, you can schedule that really at any point in time moving forward.
yeah, so great. And so, where I was going to go with that, everyone, is that scheduling an appointment, if you know that you want to do something, schedule it a day or two ahead of time. Then you're not going to have that wait time per se, and you're just going to have a virtual appointment. And by spending that 20 minutes, 30, 40 minutes in total is going to save you money. And that's where the value of Antidote comes in. I've had customer or brokers tell me that their client just wants to go straight to the specialist and pay the $100 copay, but that copay would be discounted heavily if they started with virtual. So just know that. So direct access or go the way of getting great cost savings. Carry on, Jason. I just wanted to throw that in.
Yeah, no, yeah, I think you're actually stealing my thunder from some of the future
Oh, sorry.
slides, but no. No. Again, the whole point of the model is if you choose to embrace the virtual care model and start there, it has a waterfall effect on all of the cost extending from that. So if you start there, there's some serious benefits. We'll talk about that in just a little bit. We may actually run out of time, but we'll talk about that. And again, if you want to go ahead and use it as a traditional insurance product, you can do that too. That's totally fine. But there's going to be potential, cost trade-offs if that's the way that you want to go. So I think for the slide that we have right here, we've kind of covered this. Again, you can speak to anybody 24/7. The lower cost, $0 copay anytime that a member sees an Antidote virtual provider. It is completely and totally free. As long as you want to, you can enjoy the virtual model as much as you want. There's no cap. I don't think people want to call every day, but if that was your choice, you could do that. But it's free anytime that you want to go ahead and embrace that virtual care model. And then convenience, I think that speaks for itself. Again, you don't have to leave your house. You don't have to sit in a waiting room. You don't have to find parking. You can just sit there and interact with that PCP from the comfort of your own home. So why do we design our plans this way? Well, it's more convenient. It offers better cost savings, and it's just a better member experience overall. Hopefully, I think everybody here on the phone might have had at least one or two interactions via telehealth, and I don't probably have to oversell this point, but it's the reason that we're doing this. Also, I think in terms of the last point, we do find that for folks who embrace and engage this model, there is better adherence to treatment and care plans, simply because it doesn't involve all the rigmarole, again, of having to travel. Again, for the ACA marketplace, we've got people that might be relying on public transportation. They've got childcare issues. And so to be able to remove all of those things in terms of getting you access to care is a huge value. And so we've seen a lot of people who have gone from non-adherent to adherent with their care plan simply because it's just easier because they don't have to do all the travel. And so that's another big model, and certainly something a little different than what you're going to see from your traditional carrier. So here's kind of getting a little bit more into the weeds and building on what you mentioned, Brad. So that virtual care first model, $0 copay. Again, you can use this plan as much as you want through the virtual model. It's $0 every time. So last time I checked, the best price point is zero. We've got that price point. It's zero all the time. In-person care, again, if you use we have a tiered network, but if you do need to go in person, that's also a $0 copay. Again, starting with that virtual care model, if you do have to go see somebody after that, it's still a $0 copay to go in person and talk to somebody. And then for the blended care, when you see an Antidote virtual PCP, but you get a referral to an in-person PCP, there is a discounted copay if you're referred to a specialist. So this gets down to the question that was asked earlier. $0 virtual, $0 in person. If you do get referred to a specialist, there is a specialist rate. I think the copay is about $40, so it's not exorbitant. But if you start in that model, starting with virtual care and move forward, it's extremely, extremely discounted. So just very quickly, in terms of service areas, right now we are in 2 states, Ohio being the larger of the two. In Arizona, we are in Maricopa and Pima County. For Ohio, most of the major metro areas are covered under our network. This will be expanding coming up next year, so we're probably going to add another 7 or 8 counties just to sort of fill things out a little bit. Moving ahead, we are looking at state expansion. So as the business continues to grow, and certainly from a broker standpoint, as you look to grow your business, we are looking at a few other states. I can't say what they are, but we do have our filings in place and working with the DOI in at least 3 in order to expand our offering. As a telehealth company in our origin, we do business in more than almost 24 states. And so our experience working with those areas is robust because we've already done that. We just haven't done it from the health plan side. So we're confident and bullish that our expansion plans are going to go very well and very smoothly as we look ahead. 2025 products at a glance. So again, individual plans, which is really our onus here and what we're talking about today, Arizona, Ohio. We do offer traditional small group plans in Arizona as well. So not sure if that's of interest to folks, but we do have some pretty compelling offerings there and are working with folks to try to kind of build that out as we speak. That's not going away. We'll be kind of focused on growing that business too, moving ahead. And then for ICRA, which I think is the buzzword of the year, we do have off-exchange plans in Arizona and Ohio for ICRA. And I would love to actually probably spend another hour talking about ICRA and how we feel about it. But I think universally, it seems like everybody's really bullish on that. And so we have off-exchange plans that can help those folks. So basic product features, again, just like we talked about, $0 tier 1 PCP visits. Plan options, you can also tack on adult dental if you'd like. Those are completely and totally there. And then, like we talked about, if you do need to see a specialist or get some sort of referral for in-person care, big reduction in cost if you go ahead and start with that virtual visit and virtual care plan first. We've talked about that. I'm gonna plow through that. This one is actually, I think, maybe one of the more important slides that we'll talk about today, because this really puts things into stark perspective. So, very simple case study just to show you how this whole thing works. You get a rash, right? It happens. You wake up and something's itchy on your arm. There's a couple different scenarios here in terms of how you can go ahead and use this plan. So the first is you wake up with that itchy rash, you log into your member portal, you can schedule that visit just like we talked about, under 20 minutes. And so you go ahead and schedule it. 15 minutes later, you're showing it to the doctor on the phone, and they send you a prescription, right? You get some sort of cream or ointment. You had a $0 copay for the visit. And then if you are using a generic drug, you get $0 there too. So the whole thing, within 15 minutes, you've paid nothing because it's all included, and you got your prescription, and you go to the store and you pick it up. So that's the happy path. That's the way that we're hoping the majority of folks actually utilize this plan. The second would be you go ahead, do the same thing, you schedule the visit, you go to the PCP, they refer you to a dermatologist, right? But because you went ahead and went virtual care first, that referral, you get a $0 copay when it comes time to go ahead and have that visit. So a week later, you go ahead, you schedule the appointment, you go to the dermatologist. Because it was referred through the virtual care network, it's discounted, so you only pay $40, and then you still get that $0 generic remedy when you go to the pharmacy. So even if you do want to go ahead and utilize an in-person physician, which you can, there's only a $40 copay, and you still get that preferred $0 generic drug on the back end. And then the third one is a little bit more elongated, but if this is the path that it needs to take, you want to go ahead and use the plan in a traditional way, that's fine. So you go ahead and you call your PCP. Uh, they probably can't see you that day. That's just the reality of how this stuff works. But maybe they can see you in about 2 days. So you go in 2 days later, you see them. Again, $0 copay, totally fine. Then you're going to have to go ahead and get referred to the dermatologist from your PCP. Dermatology, notorious for having long wait times, could take you a week if you're lucky. You wait a week, you then go in. Now you're seeing the dermatologist, and you're going to get an RX, but that's $100 copay for that because you didn't start. You didn't start with the virtual care model. You started by calling and just using the traditional HMO model. So now you got a $100 copay, and you're going to have to get that prescription at some point later. It's now almost a week and a half out for $35 again because you didn't start with the traditional telehealth model. So I think this kind of very clearly lays out the value prop. Starting with telehealth, starting virtually, it moves much faster. It saves a lot of time, and ultimately, it saves you money because you're engaging with the plan in that way. If you go to the third stage, this is probably no different than what you would see with any other traditional health plan, and that's kind of what we're talking about here today. If you choose to engage the plan in a traditional manner, it's probably going to be a similar experience that you might have if you enrolled in any carrier, but the value that we're bringing here is if you do start with that virtual first approach, there is substantial time and substantial cost savings as you go through that. Very quickly, so for our Arizona network, here you'll see we have pretty much the majority of the larger health systems that you'd be familiar with if you are doing business in Arizona, Ohio. Same thing. I think these should all look very familiar. We do have Cleveland Clinic, which I know is a big differentiator, but we have all the major health systems in the Ohio area as well. Chronic conditions, again, we talked about the fact that we see a greater amount of adherence for those folks who do have chronic conditions just because we remove a lot of those barriers. There's a couple of examples here. I'm not going to go into detail on each of these, but again, hypertension, any sort of cardiac condition, diabetes, these are all things where we're seeing that this model really, really helps for folks who have these sort of chronic conditions just because it's an easier set of interactions and people just have an ability to go in and plug in a much more impactful way. Options to add adult dental. We do have adult dental if that's of importance. Won't spend too much time on that one. These are the slides that I'm not going to go into a huge amount of detail on. There's a lot of words here. A traditional benefit grid, if you will. So bronze, silver, gold options. Again, I'll send this presentation out so everybody can spend some more time with this. But this will go over all of the different options that we have there. Let's see, pharmacy, major network, Walgreens sits at the epicenter of this. Really no sort of major or unusual options for the pharmacy benefit. Preferred medication lists here. I think we actually have a pretty strong value prop as it relates to the pharmacy in terms of what we're covering at that $0 level. And again, you can take a take a much deeper look at this when I send this out. But you'll see that all medications in black are zero when you get it through an Antidote virtual provider. And then all medications in black or blue on this slide are $0 regardless of whether it's a traditional in-person PCP prescriber specialist or whether that comes from whether that comes from a virtual care PCP here at Antidote.
And by the way,
Again,
that was an abridged formulary, everybody. That wasn't their whole formulary,
yeah,
just the
yeah,
list of 0 medications. There is a full formulary downloadable on the Antidote Broker portal. Carry on, Jason.
correct.
Sorry, I just wanted to throw that in.
No, no, no. I appreciate that. I know we're trying to. I see the clock ticking down up here, so I want to make sure that
Yeah.
we're moving pretty quick. The Antidote member portal. Uh, I will say this in full candidness. I think our portal is way better than some of the things that I've seen in the past. Having some experience with other carriers, really simple interface. Members tend to really enjoy the app. They can do everything directly from there, whether that's again scheduling that visit from your phone. Uh, Full transparency for member records. You can pay your bill if you have a bill, ID cards, provider lookups. It's all there, but it's designed very well in terms of being very intuitive and very easy to use. We've gotten a lot of great feedback from our members around what that looks like. Member support, again, 8 to 8. We've got a full customer service team. They can call, click, or chat at any point in time to get some more information if they've got some sort of care or concern. Just like every other carrier, we do track our NPS scores, so Net Promoter Scores. Right now, we're in the upper 70s, which is fantastic. I've been with organizations that have had low single-digit numbers, so we're hoping to keep that number up in the 70s for some time though, because we do take this very seriously. Obviously, the members are what we're focused on, and if they're happy, we're happy. So we're trying to track this on a real-time basis each and every day. In terms of working with us, we have broker support. You can call us basically at any point in time, starting in the morning all the way up until about midnight. I might actually want to update that slide. Maybe let's make it 11:30. I know midnight seems a little late. And you can certainly call me at any time. I think my contact information should be distributed through this invite. We do have a broker portal. Right now, we are in the process of making some enhancements there to make sure that we have some improved functionality that will allow you to go in and see full book of business. Also, integrating commission information, and then putting some extra bells and whistles in there too, so that if you do go in, you can download virtual ID cards for your members. You can reassign a PCP if need be through the portal, and a few extra things just to make sure that it's got a full slate of functionality that's going to help you be successful with us. So more to come on that. I would love to have a chance to come back to this forum and be able to give you a little demonstration of some of those new functionalities once they roll out. We do have a whole series of co-brandable marketing materials, so if that's of interest, and we hope it is, again, you can reach out to me directly. We've got a pretty robust marketing organization here that can help with any and all related marketing tactics. ICRA eligible plans, if that's something that you guys are going to be focused on, I think it probably is. We would love nothing more than to have those conversations and talk about ways where Antidote might be a preferred option for folks who might be interested in ICRA plans. And then competitive commissions, bonuses, and incentives. We do have a standard commission plan in place. So that's publicly available. It's actually further along in this deck, and we can go through that. We do have a OEP bonus, and then we also have an SEP bonus in place. So that'll be tiered based on member production, but OEP and an SEP bonus there as well. Enrollment tools, on and off exchange. For our on exchange offerings, obviously you can enroll through Health Sherpa. We also, if you just go to antidote.com, can enroll directly with us. Health Sherpa does run that just on the back end in terms of a white label site, but you can do that. And then for off exchange, we do have an enrollment tool, which you can go again just to antidote.com and access that off-exchange enrollment platform as well. Broker portal we talked about. This is the commission plan, so $20 PMPM for both Arizona and for Ohio. Renewal commissions, that NA will go away. It's just NA because we just started to ramp the business up in Arizona. The commission does cap out at 5 members per policy. I think that's pretty standard. And then again, we do offer small group in Arizona, and that has a $25 per employee per month factor in there. And then in terms of the bonus, I just kept the SEP because obviously OEP is not here. We will be adjusting our OEP bonus. So these numbers, when it comes to sales activity in the fourth quarter, once we get into OEP, will be a little bit different. But right now, between 2 and 50 members, there is an opportunity for a $50 one-time per member payment. And you'll see how that ladders up. If you sell more than 100, you're now getting into $100 one-time bonus per member. And that gets paid out if a member is in good standing and is still enrolled after 3 months of premium payment. I think that's also pretty standard as well. You just got to stay on the books for 3 months. And then the employment process, we work with Miramar Agent as our broker portal. Excuse me. Pretty easy to go ahead and get appointed. Again, takes about 5 days. Once you would like to get appointed, we go ahead. You'll get a user generated PIN, and you'll go through the standard process. I won't belabor this because you guys all know this pretty well. But background check, code of conduct, license check, and then you're pretty much ready to sell. But Miramar is our broker portal partner. Let's screenshot dashboard. Key dates, you guys know this better than anybody. I'm not going to spend too much time. Member payments. So right now, in terms of our book of business, so we're encroaching about 6,000 members collectively between Arizona and Ohio. It tends to be mostly in the Ohio space, so we're trying to make sure that we can get some additional traction in Arizona. The majority of our members are fully subsidized, so $0 premium plans, which is good in terms of member tenure and stickiness. If you don't have to pay, it makes it a lot easier to stay on as a member. But for those who do need to pay and have a premium, you can use a whole myriad of different methods. You can pay it online, and actually we encourage most people to go ahead and set up auto pay, just because it's set it and forget it. A lot of times the premiums can be very minimal, $6, $7, $8, and so to put that on auto pay makes it easier for everybody. You can call us at any point in time and make a payment over the phone, and if you choose to, you can still make a payment through the mail. So I'm going to go ahead and stop there. I see the clock ticking here. So I want to make sure I.
And we have a hard stop in 5 minutes because there's another training coming up after us.
You did a fantastic job. I really
job.
appreciate it. If you addressed most of the questions, additional
there
question
is one
was,
from Amy.
Are the virtual PCPs all based out of the USA?
Virtual PCPs are all based out of the United States, with the exception of, I think, about a dozen who are actually based over in Israel, but the majority are all based here in the United States.
Okay. Fantastic. We do have a little time for a couple more questions if you want to add those to the question box.
Well, this is a good one.
Yeah.
Jason. Go ahead, Jeff. You go ahead.
Oh, okay. Beth asked, can you elaborate or send out info on the Cleveland Clinic access?
Yes, meaning like a full list of site locations that are in network, or physical doctors, or both?
Yes, all the above. I mean,
Yeah,
yeah. Or how to,
That was a
how to.
loaded
What are
question.
the magic
yeah,
words when you go to the Cleveland Clinic?
yeah,
What do you
So,
say?
yeah.
guys, I'm going to tell you straight away. What I know is there in the very beginning in January, a whole lot of the receptionists or PRNs at the Cleveland Clinic offices had no idea who Antidote is. However, if your clients ever, you know, by now it should be known because many messages were sent out. But the first reference to Antidote should be the Quality Care Partners Network because Antidote leases Quality Care Partners Network in order to get the Cleveland Clinic. So QCP is what they might really want to ask first. Sorry,
Gotcha.
Jason, I've been here 10,000 times. So
Yeah, no, 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 no. No. And listen, I mean, my experience has always been, you're contracted, you're a network. Everybody in the back office knows it. When you call the front desk, they don't know, and they say, "Oh yeah, we don't accept that." That's not the case. So we've got some education work to do on our part, but it is in network.
Okay, here's a curveball
thanks.
for you. What about the Cleveland Clinic in Florida? Of course, I didn't know there was one in Florida, but
There is
fire away.
Yeah. Whew.
not open access, Gary. You would
Yeah.
probably need to ask permission from Antidote to do that.
Yeah, it's an HMO, so unlikely that they would
Yeah.
work in another state like that.
Chris has said consult with the Antidote primary care
Uh,
physician and discuss that to see if that's an option. But
yeah.
like all HMOs, and especially in the marketplace, they have state boundaries.
Okay,
So
maybe this is the last question, another really good question regarding Ohio and Antidote's coverage. Is it in network no matter which county you live in? We've got 88 counties. So, I live in Hamilton County. Can I use the Cleveland Clinic?
The answer is yes. So again, we're writing policies in the map that I just showed you. The
Uh-huh.
network the network is statewide. So if across the county border, as long as let's just use Cleveland Clinic,
Yeah.
still covered even if you drive across that county border.
Cool.
however, just one caveat there, Beth. If somebody lives in a county, is domiciled in a county which Antidote is not in,
Yeah.
say Wood County out in Toledo,
Yeah.
they cannot access a Cleveland Clinic, Antidote's Cleveland Clinic network.
They might
They
not be
must
able
be
to
domiciled.
buy. They might not be able to buy the Cleveland, or they might
Correct.
not be able to buy the Antidote plan, for example.
Yep. Yeah, it's all based on the
So,
zip code in which you reside.
so there's maybe, I don't know, 50 counties you're in. There's some
Thank you.
southeastern counties you won't find Antidote. As a result, you won't be able to go to Cleveland Clinic via Antidote. Got it. Okay, perfect.
But like for instance, if somebody lived in Mahoning County, which has been something that's come up actually quite a bit in Youngstown, Ohio, people are buying it because no other plan in Mahoning County has access to the Cleveland Clinic. So a lot of consumers are buying it for that very reason.
Yeah.
So
Hate to
just to
be the
get
bearer
access.
of bad news, but
Yeah,
we
I
have
know.
a seriously hard stop. I'm going to bid everybody adieu and wish everybody a great day. Keep the questions firing in. Send us an email. We'll get this over to Jason. Everybody will get a copy of this presentation. And,
Thank you, everyone.
thank you,
And
everyone.
and find that link to my expo, and you better be there, or Jeff's going to come after you. If you live in the Northwest Ohio or Northeast Ohio markets. All right. Thank you, everybody. See you
Everybody have a
Great.
soon.
great
Appreciate
day.
it so much. Thanks, folks.
You got it.
Appreciate it.
Thanks. You got it. Bye.